What is up? Hi. It's time. How you guys doing? Let's just hang tight here until people get signed on. As you guys are getting signed on, I need to get a sip of my vitamin and mineral drink. And I need to put on some peppermint. Yeah. You guys should get used to me by now. I do the same routine every single week. Same, it never fails, right? So let's see who's on. Can you guys talk to me? Can you guys hear me okay? I am not going to start another class until I hear that this is working. So can somebody please let me know? Give me a thumbs up or something, something. Because I've done that. I have started a class and I've been talking. And I get about 20 minutes into the class and I look at my screen and everybody's like, Terry, your audio's not working. Like, oh, that's super annoying and super frustrating. So it looks like the audio is working. So awesome. Hi, Charlene. Glad you are here with us tonight. That's awesome. Hi, Sherry. Glad that you are here with us also. Who else wants to say hi to me tonight? Why don't you guys go ahead and grab one of your favorite healthy cocktails while we're waiting for people to sign on here, and then we'll get started. How you guys doing? I'm going to tell you something. I've had a week, right? I've had a pretty stressful, actually it was last week. I talked to you guys a lot about how 50% of our life is going to be pain. 50% of our life is pain. The other 50% is okay, right? So we have this balance of pain and stress and pain and, you know, drama, I call it. And then we have this other half that's wonderful and there's so much to be grateful for. And if we focus on the 50% that's pain, because we're going to have it in our life all the time. It just is what it is, right? But sometimes that 50%, there's a lot going on in that part of our lives that is painful. And if we focus on that, it can get us really down. And it can cause some serious depression if we don't know how to navigate our thoughts around it, right? But anyway, my 50%, I'd say last week was really hard for me to get my mind around staying in gratitude, but I did because gratitude always serves you better than focusing on all the bad that is going on in your life because there's always going to be bad. So why focus on the bad? Let's focus on the good, let the bad happen, try to manage the bad, right? But it's hard sometimes, right? So, hi Emily and Tracy. Awesome. That's great. I love that you guys are all hopping on. So, I want to talk tonight about depression, obviously. And I first want to say that this is a topic that um, I want you to know that I understand that this topic is kind of controversial. And what I mean by that is what I'm going to talk about tonight is a kind of depression that can be caused by your physical body, not the chemical imbalance, just so we know, okay? Just so you guys know that. I'm going to talk tonight about the 5 top reasons why you could be getting depression due to your diabetes or some other things in your life that are physical. I am not talking about if there's a chemical imbalance, okay? Sometimes depression can be a chemical imbalance. However, though, I've seen a lot of times when these 5 top reasons I'm going to be sharing with you tonight, these 5 top reasons why people have depression, sometimes creep in and cause some chemical imbalances, but sometimes not. So if you've been clinically diagnosed with clinical depression, meaning that you're on all this medication and you know it's a clinical type of depression, then this is where the gray area is, because my belief is that there's a lot of people that have been diagnosed with clinical depression and are being put on all these medications when really it was caused by one of these 5 things that I'm going to be talking about tonight. So I just want you to be clear that, you know, I'm not saying that if you've had a clinical depression, and you're on a bunch of medications, um, that it's always 100% always caused from these 5 things. Sometimes it's not. However, I would say 90% of the time, 90% of the time, I would say these 5 top reasons I'm going to talk about tonight could be a factor in your depression. Okay. So I just want to make sure we're clear on that. So I am going to share my screen and I'm going to get started. And again, we're talking tonight about, if you are depressed, if you feel down, if you feel blue, and if it's something that has been fairly recent, or it kind of has happened at the same time you started, feeling sick, or you were diagnosed with diabetes, you got to take a look at these 5 things, because it's been scientifically proven that these 5 things have the side effects of depression. And diabetes, of course, is one of them. So I want you to really assess your situation before I give this class to you tonight. I want you to sit back and first just be open-minded to what I'm going to share with you, because again, I have been doing this for a long time. I have been coaching women for a long time, and I have seen so many women that claim or that have been diagnosed with depression. And the other thing is, once you've been told you're depressed, once you've been given that clinical diagnosis, you then subconsciously mark yourself as a depressed woman. And then you get fed all of these lies saying, well, you've got to be on depression medication for the rest of your life. It's clinical. It's, you're never going to be able to get off of depression medication. It's just part of your DNA, it's genetic. I'm going to tell you, I don't believe that. I truly don't believe that. I think that there is absolutely room for all of you guys to look at what I'm going to teach you tonight and take a look at, could it be one of these 5 things that is causing me to feel depressed, or is giving me the symptoms of depression where I had to then go on medication. So I want you to really assess your situation as I'm giving you this information tonight, and just be open-minded to maybe making some changes with some of these 5 areas, because I will tell you, it is absolutely 100% related to one of these 5 things, okay? I specifically have many examples of this in my own life. I've never been diagnosed as chronically depressed. However, there was a period of my life when I was really, really, really down. And that was when I was diagnosed with adrenal fatigue. And before I was diagnosed with adrenal fatigue, my symptoms were, I was gaining weight like crazy. My blood sugars were a little high. I was feeling really down, really tired, really fatigued. And so when I went to the doctor, they told me that I should go on depression medication because I was depressed. And I said, you know what? I feel down right now, but I don't think it's because I need depression medication. I think it's because there's an imbalance in my body, and I want to understand why. I want to know why I'm feeling this way. And what is a pill going to do? So long story short, this is before, there was even such a thing as adrenal fatigue. It was back when, it wasn't even the holistic doctors it was kind of a new thing that we were discovering that we can get, when our bodies are depleted. And so I finally learned about, what adrenal fatigue was. And the side effect of adrenal fatigue is absolutely depression, because you have physical symptoms. You're so fatigued and you feel so down because your hormones are out of balance. So I refuse, diabetes or depression medication, because that's what the allopathic doctors wanted me to take. But I listened to my holistic mentor at the time, and I started giving my body, holistic things to be able to reverse my adrenal fatigue. And adrenal fatigue is a legit thing. It's a thing. And so, part of my ability to help women with depression or diabetes or anything is understanding what the body needs in order for it to create balance. And I'm going to tell you this right now, is that anytime your body doesn't have balance, it's going to have a symptom, and depression is a symptom. It just is. Okay. So before we start this class tonight, I always have to give a disclaimer. I am not a medical doctor. I am a holistic coach, a holistic practitioner, an author, and a nutritionist. And this information I'm giving you in class tonight is not to diagnose anything, but it is to give you my opinion on on protocols and information that I have not only researched and wrote about in my books, but also it's protocols that I, as a holistic practitioner, have been able to use on my clients to help create balance in the body. I do not use medications. I use all holistic protocols, and that includes nutrition and supplements in order to create balance in the body, because the body does want to heal itself, you guys. The body is designed to heal itself. We are not told this. We're not told that the body can do this. You are told by your physicians and by the allopathic, community, that your body, once it's broken, will always be broken, and you need medication in order to fix it. That is not what I believe. I come from a place of the body knows how to heal itself, and it's been proven over and over and over for me, because I was able to not only help my body to create balance to reverse my adrenal fatigue, but I also developed cancer, and I was able to reverse my cancer holistically without any chemo radiation. And that is just by learning about what the imbalance is. What caused my cancer? If I got cancer, how do I get rid of it? You've got to be able to find out how you got it and make changes, in order to be able to kind of, figure out what the imbalance was that gave my body cancer. And it's the same with diabetes. If you have diabetes, it's never just one thing. It's a combination of many things. You guys have heard me talk about this over and over. Those of you who have been following me for a long time or in this group, that I never say anything is about one specific thing. You go to a physician and they'll say your diabetes is because you have high blood sugar. Well, why do you have high blood sugar? What's the reason? For them, when you have high blood sugar, they want to put you on medication, metformin, glipizide, insulin, whatever, to lower the blood sugar. Me, I'm going to help you, and I'm going to teach you what is causing the blood sugar to be high. You don't have high blood sugar because you lack metformin. You don't have high blood sugar because you lack insulin. You have high blood sugar because your body's unable to process and manage that sugar, right? Which then is causing you to have a symptom of high blood sugar. So it's never just one thing. And that's my position on depression. If you are depressed, there's something in your body that is not working right. And I'm just going to tell you right now, if you have diabetes, you are probably a lot of times in and out of depression, because diabetes is a severe imbalance in the body, and it's the body's inability to be able to manage blood sugar. And when your blood sugars are high and low and high and low and blah, 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 of course it's going to cause some symptoms of depression. So I'm going to talk tonight about the 5 top reasons why I think diabetes and depression are related. Okay. So we're going to go into detail about these, and then I'm going to take some questions at the end. I will also continue to kind of look at the questions as they come in the feed. Hi, Judy. Hi, Polly. Hi, Cheryl and Lisa, April, Tracy, Angela. Hi, guys. Glad you're here. All right. So the number one reason why I think, you have diabetes, which then will cause some depression, and why you have depression, is a nutrient deficiency. 100%, 100%. In fact, it was proven, I'm going to I'll leave my picture on. It was proven by Dr. Wallach. Dr. Wallach is the founder of epigenetics. He is the first holistic doctor to prove that nutrition is a huge part of how our body functions. And he proved back in 1983, he did a 12-year study that involved $25 million. And part of that was a grant, by the way, the um, a grant from the what was it from? I'm drawing a blank right now. Oh my word. He had a federal grant. Thank you. He had a $25 million federal grant to put towards this research to prove that nutrition and deficiencies were the cause of diseases in the body. So with 12 years of research, $25 million, 26,000 autopsies, 10 million blood chemistries, Dr. Wallach proved that 80%, you guys, 80% of all of these diseases are within these 4 categories: blood sugar imbalance, calcium deficiencies, digestion, and cholesterol in EFAs. Under the blood sugar imbalance is depression and diabetes. So when you have nutritional deficiencies, they're going to fall into these 4 categories, and all of these diseases are caused by nutritional deficiencies. And this was proven by Dr. Wallach's research. His book is in the Smithsonian, by the way. You can look him up. You can Google him, whatever you want. It's an amazing study. And the funny thing is this study never is released to the general public because the FDA doesn't want you guys to know that you can actually reverse your diseases with a good balance in the body and good nutrition. They don't want you to know that because they want to be able to sell drugs to you. Okay. So again, number 1 cause of depression is due to nutritional deficiency, which also is going to impact and diabetes. It's just a vicious cycle, right? So nutrition deficiency. Some of the top nutritional vitamins that you will be deficient in if you're depressed is vitamin D. You've got to get more sun. Okay. Most of us are, especially if you live in the northern, part of the country where you have snow and where you don't get sun, all year round, we are depleted. How you get vitamin D is through sun on your skin. Okay. So most of us are going to be very low in vitamin D. If you are low on vitamin D due to you aren't able to get in the sun, then you want to take a vitamin supplement, to be able to get some of that raised, because we also need vitamin D. I'm going to talk about this in a little bit, but we also need vitamin D in order for cholesterol to be able to be formed in our body. And actually, our bodies need cholesterol, by the way. In fact, if your body is low in cholesterol, then vitamin D isn't even going to be absorbed. We're going to talk more about that in a little bit, because I know you guys are thinking, well, you shouldn't have cholesterol. Well, I'm going to tell you why in a little bit. The second important nutrient or essential vitamin or mineral is your EFAs, your omegas. So your ALA, DHA, this highly affects your mood. Whoops, I'm gonna go back. This highly affects your mood. Your ALA comes from plants, and that's a huge essential fatty acid that you need to have because it affects your mood. And then DHA, where you get this essential fatty acid, DHA, in like fatty fish. So if you are deficient in essential fatty acids, you will have depression, because these essential fatty acids are really important for your hormones to create a better mood. The other thing is B vitamins. If you are low in B vitamins, B1, B12, B6, you are going to have a low mood. You just are. And if you're on, medication, sometimes that depletes your B vitamins. So again, B vitamins, especially B12, you want to get with animal protein like eggs and seafood. B1 you can get from nutritional yeast. This is an amazing product. I eat this almost every single day. It's an amazing product. And I also have this almost every single day. And if you're depleted in B1, you're not going to feel very good. Also, if you have high blood sugar, you're going to be depleted in B1. Okay, so you can get B1 through nutritional yeast. Also, you can get it through sunflower seeds. Okay, so again, if you are eating a diet that's very high in carbs, like wheat and gluten and grains, it's going to lower your B1. So the more carbs you eat, the more Bs you need in your body and the more depleted you are. Okay, number two reason why you are depressed would be stress in your life. And here's the deal, you guys. I'm just going to tell you this right now. If you have diabetes, if you have prediabetes, if you are overweight, if you have chronic fatigue syndrome, whatever the disease is, cancer, whatever it is, you're going to be depressed. It's really a heavy load to have a disease. Also, if your body has imbalance in it, like diabetes, okay, if it's imbalanced, it's very stressful for the body. And there's two kinds of stress. There's mental stress, right? But I'm talking about the physical stress right now, okay? So if you're stressed out, you are going to raise a hormone called cortisol. And that's if you're emotionally stressed or physically stressed, because this affects your sleep. And when you don't sleep, here's the deal. When you are chronically not sleeping very well, right? If you are not sleeping, you are going to have major fatigue, okay? And you're probably not sleeping well because you have diabetes. If you have diabetes, it means you have a blood sugar imbalance. Most of the time why you don't sleep is because of your blood sugar. So if you have diabetes, chances are you don't sleep very well. It's the imbalance of blood sugar. So most of the time, I've seen this over and over again. My clients who are super depressed and they can't sleep, most of the time they're depressed because they're so chronically fatigued. So chronic fatigue syndrome, or just having chronic fatigue, is due to not sleeping. And once you fix the sleep issue, they're not depressed anymore. You see what I'm saying? So it's like with me when I went to my doctor because I had gained all this weight and I was feeling crappy because of my adrenal fatigue. I was so tired, and he wanted to put me on a depression medication. I said, no, I'm not. There's something going on in my body, right? So can you help me figure out why I'm fatigued? A pill is not going to help that. Depression is not going to help that. Depression medication. It's the same thing you guys are getting when you go to the doctor for diabetes. Oh, you have diabetes, so let's put you on insulin, metformin, and you're depressed. So let's get you on a depression medication, and then let's put you on high blood pressure medication. Oh, and cholesterol too, right? So they're just swamping you with all these medications. When if you just fix your sleep and try to work on that, maybe that's the first thing you try to fix first. You will start feeling better. If you are not sleeping, you're not going to feel well. You're just not. There's no way you're going to feel well if you are not sleeping. Okay. So the question then poses: are you fatigued or are you depressed? Which one is it? Right? It could be that you're just fatigued. So work on that, and I think that might help. The other thing is the high cortisol. It's going to not only affect your sleep, but it's going to weaken your immune system. And when you have a weak immune system, you're going to get sick a lot more, which would make you feel lousy, right? You don't feel good about being sick all the time. It's also going to cause anxiety, depression, headaches, nerve problems, digestion issues, high blood sugar. So this high cortisol, high stress is causing all these other symptoms in your body. Okay. So what you can do to help with, keeping your cortisol a little lower is to make sure that you're taking vitamin D, sleep, and also exercise. So exercise is going to help you too. Okay, but vitamin D and sleep are super important. If you can't exercise right now, at least increase your vitamin D and try to get some sleep. Okay, so that's number two. Number three, another reason why you will be depressed is if you have insulin resistance. Okay, so insulin resistance causes the insulin in our body not to be working properly. And when you have insulin resistance, your body is going to not be able to store nutrients into the cell. It's not going to be able to push nutrition into the cell. So, and it's not going to be able to push your food into the cell for energy. So what it does is it stays in the blood. Your blood sugars are high. And then that also raises your cortisol because it's very stressful on your body to have high blood sugar. And then, your insulin's high. That's stressful on the body, right? So that high insulin, high blood sugar is causing the nutrition not to be able to get into the cells. And then your cells are starving. So if you guys are overweight and there's no way you can lose weight and you have cravings all the time and you're all depressed and you don't feel good, you definitely have insulin resistance. That is a part of the problem. And that's why you're not able to lose weight. And of course, if I was overweight and didn't feel good and my cells were not getting nutrified because they can't because of insulin resistance, I would feel very down also. Okay. So that of course is going to cause depression when your cells are being robbed of nutrition because nothing can get into the cell because you have insulin resistance. Does that make sense, you guys? So, if your body is not able to receive any fuel, that'd be like if it'd be like if I had a car and my car was absolutely empty on gas. It was on E. Okay. And I went to go get gas and I couldn't get the gas nozzle into my tank because there was something in the tank that wouldn't let the fuel in. It just was blocked. I couldn't get the fuel in. It was not able to receive fuel. I wouldn't be able to run my car. There's no way. It wouldn't work, right? It's the same thing that's happening with the cells in your body. Okay? If you have insulin resistance, your cells are being blocked to get any fuel into the cell. And if you're not having any energy and you're having fatigue and not getting any energy, of course you're going to feel depressed. I mean, it's like a no-brainer. So instead of getting depression medication, how about we fix your insulin resistance, right? So how you fix this is by healthy nutrition, knowing what to put in your body that is going to fix the cells and create and fix the insulin resistance, and learning how to intermittent fast the correct way. There's a good and there's a bad way to intermittent fast, and it's very hard to do if you rush into it. You've got to do it slowly. You've got to incorporate slowly because you got to make this a lifestyle. So I teach you how to do both of these inside the academy, of course. All right, the number four reason why you are depressed is because you probably have too low fat of a diet and or low cholesterol. Are you hearing me? Are you hearing me, you guys? Ladies, your body needs cholesterol. Cholesterol is the precursor to produce these hormones. If you do not have cholesterol in your body, you are going to be low on estrogen, testosterone, cortisol, serotonin, and vitamin D. You can take all the vitamin D in the world, but if you don't have enough cholesterol in your body's not going to be able to convert or utilize that vitamin D in your body. Isn't that crazy? So I know some of you are like, well, I was told by my doctors that I shouldn't have cholesterol. No, 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 no. You know what? Our bodies make cholesterol. Did you know that? Our bodies make close to 3,000 milligrams of cholesterol per day. Our bodies make it. Okay. So a lot of times, if your cholesterol is really high, okay, the bad cholesterol, but actually the bad cholesterol really isn't even bad. I can't even go down this road right now. It's in a whole nother class. Bottom line is you need cholesterol. Our body makes it on its own. It makes about 3,000 milligrams a day. That's like what, 2 dozen eggs, something like that. So, our body needs it. If your body is too low on cholesterol, okay, if your body is too low on cholesterol, then your body's going to have a hard time making these hormones, and you're going to be deficient in estrogen, testosterone, cortisol, serotonin, and vitamin D. And I can tell you what, if these hormones are all too low, you're going to feel really depressed. I tell you what, you are going to feel extremely depressed for sure. For sure. Okay. All right. Number 5. Oh, you guys, this is such a huge one. If you are depressed and you have diabetes, you're probably on medications. And the side effects of these medications, almost all of them, the side effects are depression. Metformin. Do you know that metformin blocks the vitamin B1 in your body? So if you're on metformin, your body can't even absorb B1. B1 is one of the major vitamins you need for energy. And you are going to be deficient in B1 if you're on metformin. Okay, so there's so many of these medications that impact how your body absorbs nutrients, and the side effects are also causing your hormones to be unbalanced in addition to nutritional deficiencies. So metformin is one. Another one is insulin. If you have high insulin in your body, it's causing inflammation. If you have inflammation in your body, that's causing your blood sugars to be high. If you have high blood sugars, what's that doing? Right? So high insulin in your body is not good. And this is what you will always get prescribed. If you have high blood sugar, they're always going to give you insulin. But you know what? When you're on insulin, if you're on injectable insulin or a pill form of insulin, you are not going to be able to fix your insulin resistance. It's making the insulin resistance worse. So again, when you have high insulin or insulin resistance, the nutrition isn't getting it into the cell, right? You're starving, and also you have a lot of inflammation from insulin. So, of course, what's the remedy? To get you off of insulin. How do you do that? I can help you. It's not a this is what you should do sort of thing. It's a process of understanding how the body is working and what's off. But you've got to get off. If you're a type 2 or a pre-diabetic, you've got to get off insulin. Type 1, no. Type 1 is different. Type 1, it means your pancreas isn't producing insulin. Okay. However, if you're a type 1 and you're overweight, it's because you have too much, you're being over medicated. So what I can do is help you to reduce the amount of insulin that you need, and then you will feel better. Your inflammation will decrease, your depression will head up or lighten up, and you will lose weight. All right, enough on that. Number 3 for the drugs is statins. Statins have major side effects of depression. If you read the label on any statin, and a statin is for cholesterol, by the way. So if you go to the doctor and they think you have high cholesterol, they're going to put you on a statin. And so if you're on a statin, if you read the label, it's one of the side effects of statin is depression. So you can pretty much be guaranteed if you're on a statin, you're going to feel depressed. The other one is antidepressants. Isn't it kind of ironic that when you get put on an antidepressant, it actually causes depression? Right? But what it does is SSRIs, or depression medications, increase your blood sugars. Okay? What happens when you decrease your blood sugars? Or increase your blood sugars? What happens when you increase your blood sugars? Well, then they're gonna be worried about your blood sugars high because you shouldn't have high blood sugars. And then what they're gonna do? They're gonna put you on metformin and insulin. And then what's that gonna do? It's gonna cause more insulin resistance. And then what's that gonna do? It's gonna cause depression. So again, wouldn't it be amazing to be able to fix the imbalances and balance the body to help get you off of depression medications? That's the remedy. That's the remedy. Corticosteroids is another drug that the side effects of this are depression. And these are drugs that help decrease inflammation in the body. So it's like hydrocortisone, phonates, prednisone, things like that you're giving when you have inflammation. So you go to a doctor and you have diabetes and you have swollen feet, swollen knees, osteoarthritis, fibromyalgia. They're going to want to give you steroids and then prednisone and hydrocortisone, all this stuff, because fibromyalgia, inflammation in the body is inflammation for a reason. It's because your body's inflamed. It's telling you, it's giving you a signal that you need to figure out why it's inflamed, right? If you put a drug on top of it, it's going to cause more inflammation. So these corticosteroids are absolutely designed to cause long-term depression, even though it might be a short-term fix. If you're chronically on these, for a period of month or 2 or 3, you are going to be increasing your inflammation and increasing your insulin, and that's always going to cause you not to feel well. And when you don't feel well, you're going to be depressed, right? Do you kind of see what's going on here? The last one I want to talk about is beta blockers, and beta blockers are heart medications. And if you have diabetes, chances are you were told you need to be on a beta blocker because you have high blood pressure or because you have chest pain or because you have arrhythmias, okay? So if you're on beta blockers, one of the side effects of beta blockers are also depression, okay? So, again, it's pretty ironic that you're being put on all these medications, but then all these medications have the side effect of being depressed, right? And all of these medications are very, very related to diabetes and prediabetes. So let's recap, and then I want to take your questions. So go ahead and start typing in your questions. But let's review. So to recap, we have number 1 is nutritional deficiency, number 2, stress, number 3, insulin resistance, 4, low fats in your diet and also low cholesterol, and number 5 is medications. Okay. What I want to do, though, you guys, is I want to share a story with you. And Ingrid might even be on tonight. I don't know if she's watching or not, but I want to share Ingrid's story with you. She is an amazing woman. When she started with me, her blood sugars were in the high 100s. She was on 9 medications, including depression medication. And she never really thought that she could get off medications. She had diabetes and was very down. She's very, very down, very depressed. And I understand why. We understand why she was. Looking back at it, all the medications she was on and just some of the things that we were working on, she was feeling very blue. She had a lot of imbalance in the body. And we can now say, a year later, her blood sugars are normal. She's off 9 medications. She's lost 60 pounds. She's off her depression medications. And if you ask her, she will tell her that her quality of life now is so much better since she's been off these medications and since she's created balance in her body. She took these 5 areas that I went over tonight. She took these 5 areas: the nutritional deficiency, stress, insulin resistance, low fat, cholesterol, and medications. All those 5 areas were causing her depression. And we had to dig into each one of those areas and work on them separately for her to be able to create balance in the body. And now she's a vibrant, amazing, beautiful. She wasn't beautiful before. That's not what I'm saying. But I'm saying just when you look at her now, she's got a smile on her face and she's no longer depressed. You guys, there's something to be said about quality of life, right? When it comes to how you live your life, there's something to be said about quality of life. And I understand if you are depressed, that is no way to live. It is hard. It is so hard to be depressed. You wake up every day and it's a struggle to get out of bed. It's a struggle to get motivated to do anything. This is why a lot of people have a hard time with starting a health protocol, because they're just so fatigued and tired that they just are at their wits' end and they just don't feel good, right? So, I understand, but I want to encourage you guys, those of you who are struggling with depression and diabetes, they are so related. And, I want to be your coach. I want to be the one that helps you with this, because I have seen over and over and over and over again, and you've heard many people come in here in this group and say that it is possible to be able to get off depression medications, get off diabetes medication, and improve your quality of life. Okay. And I get it. It is not fun to feel miserable. I've been there. I know what it feels like. It is not fun. But what the good news is that once you are able to identify the imbalance in the body and start taking the steps to create those changes and that balance, oh my word, you feel amazing. So real quick, before I take your questions, I want you guys to look at this chart just so that you truly understand how I am different than your medical doctor. I want to be a part of your medical team. I want to be a part of your team. Okay. Your medical doctor is going to always manage your drugs, your medicine, your metformin, your labs, and all of your diabetic medications. What I'm going to do is help you with the nutritional protocol, your exercise. I'm going to be a support, a coach for you. I'm going to help you with your supplements. I'm going to coach you, and I'm going to help you eventually help you to wean off of a lot of these medications, because once you start creating balance in the body, you guys, that is when you can start to get off, your doctor will start pulling you off of these medications. And that's a beautiful thing, because your depression will lift. Your depression will lift when you can create balance in the body. It's so beautiful. It's an amazing thing. And I love those of you in this group, right, who have been with me a long time, and you've shared with me how your depression has lifted just since you've been working with me and since you've been applying some of the principles I've been teaching you. I love hearing that. That is what drives me. That is what drives me, is to help you ladies to feel good, because I know what it's like not to feel good. It sucks. And here's the other thing. When you don't feel good physically or mentally, and you're depressed, you don't treat others well, and you don't show up in the world as a vibrant human being, right? You just don't show up for others. You're not probably as good of a wife as you want to be. You're probably not as good of a grandma as you want to be. You're probably not as good of a friend as you want to be. You're probably not as good of a employee that you want to be, right? So, the good news is that you have the control to be able to make the decision to do something about it. But you have to just make the decision to do something about it. So I am going to propose this to you right now. I am going to ask that all of you guys take out a pen and paper and write down this address, VIPwaitlist.com. If you are not on my VIP waitlist, you need to get on it now. My academy is not open right now. I'm not taking any new clients right now. However, it will be opening up again in a few weeks. If you are not on this VIP list, your chances of getting in are very low. So get on my VIP list, because you'll be the first person to know when the academy is open, and you'll be the first person to be offered a spot inside the academy. And this is where I will help you. I will be able to help you with your depression, with your diabetes. It's a beautiful thing, and I can't wait to do that. So with that being said, get on my VIP waitlist, VIPwaitlist.com. Get on there, and then you will be receiving information from me in the upcoming weeks about, just how you can become a part of our sisterhood. So with that being said, I am going to go to my screen, and I want to take a few minutes. It's already 8:15. I'm trying to keep these shorter, but heaven forbid I can ever be short-winded on these classes for you guys. Oh my word, right? So let's look at some of your questions. Does anybody have any questions for me? Charlene, what should your cholesterol be? It should be between 160 and over 160. I've even had, it's even okay. Okay, I gotta be careful how I answer this question. If somebody's working with me and their cholesterol is over 200 or 300, it's fine, because I know their protocol that they're on. Okay. So it's hard to answer that question, because it does depend on what you're eating. If you're eating really bad food that's raising the bad cholesterol, then your cholesterol shouldn't be high. Okay. So that's all I'll say about that. Okay. Because cholesterol is not bad. It's not bad. And so the number is going to be determined based on what you're eating, what your other labs are saying, because again, if you have diabetes, that affects your cholesterol too. So it's a kind of it's a good question, but a hard one to answer unless you're working with me, because there's variables based on what protocol you're on. Good question though. Love it. Cheryl, how does hypothyroidism contribute to diabetes, or is there a correlation? Yeah, there's absolutely a correlation. When you have high blood sugar or high insulin, it does affect how the thyroid works. Also, you got to remember, when you have high insulin, it blocks nutrition getting into the cells, right? So if you're not getting any nutrition into the cells, it can cause your thyroid and your endocrine system to be suppressed. And that's, yes, so it's absolutely related. Great question. Is there a test if the cortisol is too high? Yes. The thing with cortisol is that most people will do a blood cortisol test, which will give you information, but the most accurate cortisol test would be a saliva cortisol test. And you want to find a practitioner who tests your cortisol 5 times per day with saliva. There's not a lot of practitioners that do it. I do, but there's not a lot that do, because it's a holistic way, right? So when you go to a doctor, they'll do a 1 cortisol, which is blood, and the blood isn't as accurate because the blood cortisol is bound. And when you do saliva cortisol testing, saliva is in your tissues, right? So that's the active hormone in your body. Cortisol in the tissues is the active cortisol level. So that's what I like to test. And we like to see the cortisol levels at different times of the day, because that indicates and gives us information about how your adrenals are working. Great question. And that's my answer. Are there natural ways to help with depression while you make the journey of getting yourself happy, healthy? Susan's in the academy. She's asking this question. Well, I don't know if you tuned in late or if you just tuned in, but the whole class was basically that. I gave you 5 areas of what causes depression, and what you do is in those 5 areas, you start working on all the areas, which is what you're doing, Susan, by the way, inside the academy. So what I do is I take everybody and we start working on all these areas. Sometimes we go one at a time, and sometimes we do them all at the same time. So you have to just start making sure that you are, getting nutrified is a big one, and fixing up your protocol, making sure that you're, eating better. And when you're depressed, that's the other thing, is when you're feeling depressed, what do you guys do, right? What do you do when you feel depressed? You want to eat cupcakes because you're so blue. And cupcakes, when you binge on cupcakes, at the moment, it feels very good to eat cupcakes. Because what does is it instantly, the cupcakes, the sugar, the food gives you an instant dopamine hit. It goes right to your brain and you get this instant high. But then what happens after 5-10 minutes after that? You crash, you feel guilt, shame, and it absolutely is not helping with your inflammation and your insulin resistance, right? So, the eating is such a critical component, and what I help you guys do. As a woman, if you're an emotional eater, which 95% of all women are emotional eaters, I help you with that because you have an addiction to food. If you're an emotional eater, you've got to, I shouldn't say addiction, that's a harsh word, although that's what it is. If you're a binge eater and emotional eater, you don't have a very good relationship with food. And so what I do is I want to help you with that relationship with food. Until you fix that relationship with food, okay, it's going to feed back into that feedback loop of increasing your diabetes, and then, making you more depressed. So, this is why it's so important to find somebody that you trust that can help coach you through this entire thing, because it's just hard to do it on your own, ladies. It really is. It's especially when you're depressed, because when you're down and you're blue, first of all, you don't have the energy, or you don't feel motivated to do anything, right? Because you're tired, you're depressed, you're down on yourself, your thinking's wrong, you're not getting what you need emotionally or nutritionally or physically. You're just blue, right? And if you have diabetes, you're really out of balance, and that's a part of it. So it's so important that if you're at your wit's end, and if you're at a point in your life where things aren't getting better, you've got to find me. You've got to just, it's time to do something about it. Your quality of life is so important. And if you're living on this earth and your quality of life sucks, there's no way to live. There's no way to live. It's just no way to live. So unless you can, be brave enough to, you know, find how to do it yourself, which is another thing. It's like what I do is I take all the confusion out for you, because when you try to go out on the Google or the Dr. Google or the internet, or try to do it on your own, there is so much information out there, right? In fact, most of you guys in this group, when you hear me talk and you hear these classes, it's very different. What I'm teaching is very different from what you're Googling, right? But yet you see all the results I help my clients get. I'm committed to giving you guys the truth and the facts. And the facts is it's really hard to do this on your own to get total balance in the body. You can do it on your own for a while and might get short-term results, but if you want long-lasting results, it's just really hard to do it on your own. You need a culture of women that supports you and understand what you're going through. You need a coach that understands. You need a coach that knows what she's doing. You need somebody that can help you talk to your physicians, because your physicians are only going to give you the allopathic remedy, which is drugs and surgery. That's what they're going to give you. They're not going to give you anything else. They do not know about nutrition. They don't know it. They're not taught that in med school. They get 1 day of nutrition in med school. 1 day. Oh my gosh, it took me 20 years to learn everything. You know what I'm saying? So you just gotta, if you're struggling with depression, I get it, but you've got to just step up to the plate and say, okay, I'm willing to give, something a try, and to do something other than what my medical doctor is doing. Now, again, remember, there's a difference between depression and clinical depression. If there's this is where the issue is, because most people who have been diagnosed as clinically depressed, really aren't clinically depressed, but some are. Some have, some need some short-term medications if they're diagnosed as clinically depressed, and if they really are. And so that's the kind of the question is, are you or aren't you? So that's where you need help with with somebody like me to see if you really are clinically depressed. Because once we take these 5 areas and we start to balance out the body, you'll know pretty quickly if you're going to be able to come out of it or not. Because most of the time, like I said, even if you are on medications and you do this work, you're going to feel better, and you're going to be able to decrease the medication or possibly go off of it. Okay. Anyway. Okay. What's next? Is there a natural way to lower your cholesterol? Yeah. By eating cholesterol and eating the right things, and by reversing your diabetes. Because if you have diabetes, prediabetes, if you have high blood sugar and high insulin, you're going to have high triglycerides and high cholesterol. They're all related. So you could still eat a really good diet, but if you are a diabetic and you don't know what you need to do and what medications you need to wean off of, you're gonna always be on cholesterol medication because your doctor said you need to be. I'm going to get you off of them, because that's what we're going to do. And I'm going to tell you the why. This is the thing. This is the difference between this group where you guys are in now and my academy. Okay. In this group, I get 1 hour with you a week. Okay. And in this group, I can't work with you as a client because, I don't know about your situation. It'd be very unfair for me to give you questions about your specific situation if I don't know about your entire situation. So what I give you in this group is general information that you can take. Okay. But if you don't implement it and you don't know how to implement it, that's an issue. And that's what I do. In my academy, you get me 8 to 10 hours a week, and you get to talk with me. And I look at your blood labs, and I help you talk with your physician, and I help you with, customizing your protocol. And I can answer these questions that your guys are giving me more specifically because I have your entire profile in front of me, which is, all the information I need. It's the big picture, you know? This is what doctors do. You go into the doctor's office and you have 15 minutes with them and you tell them you have a symptom. What do? They look up the symptom and they go, oh, okay, let's give you a medication. And they do fractionated diagnoses. They give you a diagnosis and they fraction, by seeing what the symptom is, and then they give you medication for it. That's not what I do. I get a whole picture. I'm like a health detective. I get a whole entire picture of everything that's going on, including what the doctor is telling you, right? I get the entire situation. And then we work with a process to try to create balance in the body through many different steps that I teach, including, understanding what your blood labs mean in your situation. And then we have weeks and hours together, not just one 15-minute session in 3 months that you do with your doctor. It takes hours of trying things and and making sure you're getting results and seeing things. And that is something that I only can do inside the academy. You understand why, right? I can't do that in here. I can give you great information, but here's what's different. The implementation process and being able to communicate with me in a group with a bunch of sisters, that's the magic. And that's what I am just trying to get through to all of you ladies in this group who are at your wit's end and need to do something different. Okay? In a few months, when I open up the academy, there should be no question or thought in your brain about joining. It's got to be your time, because some of you have missed 3 or 4 of my launches now. Every time I've opened up the academy, you haven't joined. And why? And you're not getting better, right? Right? Some of you might be, but you probably not. So you just gotta join us, because in my academy, these girls are on fire. And if you do the work and you do what I say, it works. And it's just amazing. And I am here for you. And that's what I do. Is I am committed to my girls. I'm committed to you guys in this group, but I'm committed more to you when you join my team, because I can be. I then can actually, talk with your physician, and I know more about your situation, and I can advise you. In this group, I just have to be very generic in what I advise. Okay? So I hope that makes sense. All right, you guys, I'm going to take one more question, and then we're going to go, because this is getting a little long. Karen, they want to put Jason on statins. Of course, but if he's not willing to change his ways, statins aren't going to work anyway. But if he's not willing to change his ways, it's not gonna, they're not going to do any good. I'll answer one more question. Dane asks, how long are you in the academy for? The academy is a membership. So when I open it up again, just get on my VIP list, Dane, viplist.com. Get on that, and when I open up again, I give you all the information about the academy. It's a monthly membership, but you're in it as long as it takes to get to where you need to be. And I usually, yeah. So that's all I'll say. So get on the wait list, ladies. I am going to go. This was an amazing call tonight. I love this topic, because I just think so many women feel so defeated, and they feel like it's their fault that they're depressed. I'm going to tell you right now, it's not your fault. It's not your fault that you're depressed. It's not your fault. And for 95% of you, it's not genetic. You're not depressed because you were born depressed. It's genetic. You're depressed because of one of these 5 things that you've chronically been doing over the 20, 30, 40 years that you've been alive, and it's just adding up. And then your allopathic medical doctor has failed you by giving you medication after medication, which is actually causing more depression and worse symptoms. Okay, so get on my wait list. I'm here to help you. I will see you guys next week. Great questions. I love you guys. I look forward to talking with you every week. If you have any other questions, if you're watching the replay, just tag me in this group and put the question in the comments underneath this video, and I will try to answer them as best I can. Love you all. Have an amazing night. Bye.